So welcome to today's session. In today's session, we are looking at polio. So we'll go straight to look at the scenario for polio today. And this is coming from the June 2025 paper. The scenario says, Mr. Chomba John, a male child aged 10 years, has been brought to the health facility where you are working as a public health nurse with history of sudden onset of weakness of the lower limbs. After physical examination and history taking, your provisional diagnosis of poliomyelitis is made. Question A, define poliomyelitis. Question B1, state the mode of transmission of poliomyelitis. Question B2, outline 4 stages of clinical presentation of poliomyelitis. Question C, describe the nursing care you'd give to Chomba from admission till discharge. And question D, explain 5 preventive measures of poliomyelitis you'd give to the community. Going straight to question A, we can define poliomyelitis as this is an acute viral infectious condition caused by the polio virus affecting the central nervous system, characterized by fever, pain in the muscles, paralysis, and muscle atrophy. So that is how we can define poliomyelitis. Question A2 rather says, state the mode of transmission of poliomyelitis. The primary mode of transmission of poliomyelitis is through the oral fecal route. Now, through the oral fecal route, different ways we can easily get or ingest this. Children can ingest this particular virus, leading to infection. One of it is through drinking contaminated water or food. This can easily result in entry of the virus in the body, and of course, once it enters the body through the oral route, it mostly irritates the oropharynx, entering the bloodstream, going all the way to the central nervous system and targeting the nerves, nerve damage. And the end result is what we see as paralysis and all those symptoms in polio. Also, sometimes it's direct contact with the infected person. In this case, like when changing nappies for the baby, because the polio virus can still be excreted through feces. Hence, a person can easily contract or get into contact with the polio virus itself, increasing the transmission rate. Apart from that, also less commonly in the early phases of polio, it can also spread through droplets when sneezing, especially in the early phases when it is entering the body through the oropharynx or the nasopharynx. It will cause irritation on the throat, causing sneezing, and that may still be a way of coming into contact with the poliovirus through droplets. Apart from that, of course, we can still get poliovirus through flies. For example, flies may sit on infected feces, sit on food, and that the child is eating, and that becomes the mode of transmission. When we talk about fomites surfaces, sometimes someone may touch infected maybe nappies or feces, and they touch other surfaces, and that is the mode of transmission through fomites, meaning that if another child touches the same surface or another person touches the surface, they may get the virus through fomites. So these are different ways that the poliovirus may spread apart from these ones mentioned. Question A2 said, B2 rather said, outline 4 stages of clinical presentation of poliomyelitis. In terms of the clinical presentation, the question says outline, meaning that you are listing based on the stages. And the first stage is prodromal stage, also known as the subclinical stage. This is where we see symptoms such as fever, we see headache associated with vomiting, generalized body malaise, as well as sore throat. Among other symptoms seen on this first stage includes muscle pain, neck stiffness, and of course restlessness, and many others. So these are the symptoms that are seen on the prodromal stage, also known as the abortive stage. The next stage of symptom is known as the non-paralytic stage. And during the non-paralytic stage, we see symptoms such as restlessness, limited spinal reflex, muscle tenderness, painful back and muscles. All these symptoms are seen on the non-paralytic stage. Kenning's sign and Brzezinski's sign are symptoms. They are also seen during this stage. The third stage is known as the paralytic stage. And this stage, there is paralysis of the limbs, paralysis of the shoulder girdle, paralysis of the muscles of the deltoid muscles, paralysis of the intercostal muscles and diaphragm, and also loss of deep tendon reflex. So these symptoms may be seen during the paralytic stage. Apart from that, also flaccid muscles may be seen, muscle wasting, because the muscles are not receiving any impulses from the brain whatsoever because of the blocked cranial nerves by the poliovirus. Hence, we see muscle wasting because there's no blood nutrients being supplied to the affected body tissues. Difficulties in breathing may now be seen because there's paralysis of the intercostal muscles and the diaphragm itself. And of course, difficulties in swallowing may also occur because of paralysis of the muscles of the pharynx. This will also affect the ability to cough. Of course, that is the third group of symptoms that is seen in terms of the clinical features. The last stage is known as the recovery stage. Now, on the recovery stage, only two possibilities are seen. It's either there's temporal paralysis or permanent paralysis. So temporal paralysis will occur where, of course, the neurons that are affected were not badly affected, so they end up regenerating in terms of the scar tissue that formed. If it was not too much, they will easily regenerate and go back to a state where they are able to function normally. But if the damage or the scar tissue is severe enough, the damage is going to be permanent. This child may be paralyzed forever. They may lose affected structures and limbs forever without recovering at this particular phase. So still recovery of a child who has suffered from polio may go all the way up to around 18 months. Hence, polio is best prevented rather than treatment or managing the symptoms of polio, because the child may be severely affected at the time you're trying to control the condition itself. The next question says, describe the nursing care you'd give to Chomba from admission until discharge. Here you talk about aims, talk about the patient isolation stroke environment, infection prevention, disease notification, talk about observations, talk about the psychological care that you give to the mother, hygiene, nutrition, medication, medication elimination, and advice on discharge. So these are the details that you can give, that you can use as you write the nursing management in details. So make sure at least on each heading you're writing clear points that can easily relate to the heading that you have written above. Headings like psychological care, at least the least or minimum of points you can have, even if you're stuck, it is at least 4, because on that heading a lot of points can still be generated. Talk about hygiene, talk about the nutrition that you give to the child, talk about medication, talk about elimination, of course, and that is how you talk about the management of a child with polio. The last question talked about explaining the 5 preventive measures of poliomyelitis you would give to the community. This includes immunization. Give IEC to the community about the importance of immunization. And we have mentioned that polio can best be prevented through immunization rather than treatment through symptomatic management. Talk about hand hygiene. We are saying polio spreads through the oral fecal route, meaning that hand hygiene is cardinal to prevent harboring of microorganisms or the poliovirus through the hand and ending up ingesting it together with foods. Sanitation, proper disposal of fecal matter is very cardinal in sanitation. Public surveillance, observing the trends of the condition. Where is it coming from? Where is it originating from? Where are cases being reported from? This will help control the spread of the condition and also just manage it. Or maybe it could be water sources that is contaminated or lack of toilets. So by doing public surveillance, you know what the problem is because you know where these problems are coming from. Health education, the community, once they are aware about the condition, how it spreads, of course, in terms of mode of transmission, the community can be aware on how to prevent it and put measures to prevent high exposure to polio itself. So these are some of the measures that you can talk about. The points here are just a bit summarized or more summarized. Try to add more meat and more explanations because the points that you are given here are just some leading points and you cannot get 25 marks with just summarized points like this. So at least try to add some meat. Sometimes you may be asked for a nursing care plan, and some of the problems you can use in polio includes impaired physical mobility related to neuromuscular weakness and paralysis evidenced by paralysis of the limbs, meaning that these are nursing diagnoses that you can use in case you're given a nursing care plan, but at least try to complete these ones in terms of the goal, the interventions, and of course the evaluation that you can write. Other problem you can see is altered thermoregulation related to viral infection evidenced by elevated body temperature of 39 degrees Celsius. We can also see acute pain related to viral infection and muscle spasms evidenced by patient's verbalization of pain. This is a 10-year-old child who can still verbalize if they're experiencing pain. Risk for imbalanced nutrition less than the body requirement related to muscle weakness and difficulties in swallowing. And of course, the fifth problem you can talk about is risk for impaired skin integrity related to prolonged immobility and sensory alteration. The child who's paralyzed may have prominent areas or prominent bones exerting pressure on surfaces. Hence, we see that there may be a risk for impaired skin integrity. So in terms of nursing care plan, these are the problems that we can use. In terms of answering this particular question for polio, this is how it can be attempted. Till next time.